Thank you, Madam Speaker. I am humbled to stand before you today to revisit a very important topic as I present the third reading of my private member's bill, Bill 250, Recovery Month Act 2021. This bill will proclaim the month of September in each year as Recovery Month. Karen Wardell, Executive Director of House of South Rosen, stated, "This bill, if passed, would support ongoing efforts to eliminate stigma and raise public awareness. Ontarians who are impacted by mental illness and more specifically addictions need to know they can access the help they require without shame. No one understands the importance of recovery more than the people who have been through the process. The confidence and joy discovered through recovery the purpose Sarah's life. As she explained in her story, quote, "Today, my distress level of tolerance is strong, and I am coping well with the epidemic. I am a strong, healthy woman who is able to sustain myself and have a purpose. I am now able to pay it forward," end quote. Speaker, individuals and families across the province too often face challenges related to the addictions and mental health. While facing alone, they too often suffered in silence, surrounded by stigma and shame. Today, we can choose to break the silence, speak up to the stigma, and stand out from the shadows with those affected by mental health and addictions in the absence of shame. Today, with Bill 250, Recovery Month, we remind them that they are not alone. We see them, we hear them, we are here to support them in their courageous recovery efforts. We care. The subject of mental health and addiction is difficult for us to acknowledge as a society. I ask you to imagine the sense of helplessness and how much more painful it is for those affected directly by these kinds of serious health challenges. Individuals and families who are caught in the cycle of addiction, compulsions, and cravings often find that their strength betrays them. Substance use and mental health affects every aspect of their lives, including their work, school, and personal relationships. They need to know that there are resources and support available to help them recover, so they can lead productive lives in their communities, just like Sarah. Recovery is real and it is life-changing. Speaker, we must use our collective voice to inspire real change in the public perception of those afflicted by addictions and mental health challenges. Feelings of shame and stigma associated with mental health and addiction are unfortunately common and may prevent people from finding the courage to seek help or to accept it when offered. The power of shame and stigma are major impediments to progress in the area of mental health and addiction and must be confronted. Let's strive to repress shame and with empathy. Let's work to end the associated stigma and replace it with admiration for the courage it takes to seek and accept help. Speaker, anyone can be touched by mental health and addiction struggles, and it should never be shameful. Bill 250 Recovery Month will fortify the message that there is no room for stigma and shame. Speaker, while it is critical to acknowledge the realities and the consequences of untreated addictions, trauma, and mental health crisis, the purpose of Beer 250 will inspire people to see a bright future that they cannot always see and to choose life and health over death and despair. In communities all over Ontario, we see the success stories of survivors who accepted the lifeline offered to them and are now thriving, healthy, and hopeful. They not only live to tell their tale, they give us hope that recovery is possible. Speaker, Sarah is just one example among many whose story inspires true people, true hope. There is nothing more powerful to someone in crisis than the true life experience of the real human being who has walked in your shoes on their road to recovery. People need to trust that recovery definitely is possible with help. Speaker, Beer 250 Recovery Month in September will act as a public call about the need for awareness surrounding mental health and addictions issues and the hope of recovery and transformation. Beer 250 may be to some symbolic gesture. I assert that this beer gives us the prime opportunity to bring about change by taking the first step toward emphasizing the possibility of recovery, which begins with awareness. Every successful recovery journey begins with the first step. Speaker, we know that since the onset of the COVID-19 pandemic, the need for mental health and addiction services has increased. Overdoses are on the rise as people suddenly surrendered to their addictions, sometimes by accident, and tragically, others died by suicide because they cannot see in the moment that they have another choice. Speaker, in fact, during the pandemic, when Ontario's healthcare system is overwhelmed with caring for COVID-19 patients, it is also dealing with an increase in the numbers of people in crisis presenting to hospital due to substance use, mental health situations, and the associated deaths. Speaker, according to Addictions and Mental Health Ontario, 22% of Canadians will be affected by addiction in their lifetime. In Ontario, we are blessed to have a variety of mental health and addictions resources and organizations who provide help to those in need. KMEDS is Canada's largest mental health and addiction teaching hospital and world-leading research center. KMEDS combines clinical care, research, education, policy development, and health promotion to help transform the lives of people affected by mental illness and addiction. Speaker, with a dedicated staff of more than 3,000 physicians, clinicians, researchers, educators, and support staff, KMEDS provides clinical care to more than 34,000 patients each year. As an organization, they want to do for mental illness what others have done for epilepsy, heart disease, and cancer. They want to help people see mental health for what it really is, health. There are many more terrific organizations that I have communicated with in my outreach to better inform myself while preparing to bring Beer 250 before you. Addictions and mental health organizations represent over 200 organizations that provide frontline substance use, addiction and mental health support and services. Speaker, every year, local mental health and addictions providers in Ontario have more than 300,000 Ontarians on their road to recovery. Ho CEO Adrian Spafford recently stated, there was a mental health and addiction crisis in Ontario before COVID-19, and the pandemic has only put additional pressures on the people of Ontario and our healthcare system. There is no recovery from this pandemic without both the physical and mental health of Ontarians. We need to work together to ensure supports and services are available to people when and where they need them most. Speaker, founded in 1918 with 30 branches in Ontario, the Canadian Mental Health Association provides services and support to over 1.3 million people across Canada through the combined efforts of more than 500 staff and 11,000 volunteers. Speaker, this week between May 3rd and May 9th marks the Canadian Mental Health Association's 70th annual Mental Health Week, with this year's theme focusing on understanding our emotions as a way to promote mental health. Speaker, I feel especially privileged to present my third reading of Bill 250 Recovery Month during this significant week that is intended to encourage us all to recognize, understand, and express our emotions, even when they make us uncomfortable. It is so important to establish and connect with the support system that can make us feel better and help us get through these challenging times. Speaker, our government remains fully committed to ensuring Ontarians of all ages in every corner of the province have access to the highest quality mental health and addiction supports where and when they need them. Through this year's budget, we are making record-breaking investment in mental health and addiction care with a total of $525 million in net new annualized funding in this year alone. Speaker, our government has also invested $194 million to immediately expand access to safe and effective mental health and addiction supports during the COVID-19 pandemic to address the increased need for these supports. Not only this week, but often, I encourage people to reach out to family members, friends, or their colleagues and ask them how they are really feeling. Speaker, for those who are experiencing a mental health or addiction challenges during this difficult time or any time, help is always available. Speaker, I would like to thank each mental health, addictions, and counseling organization, their professional staff, and teams of volunteers for their incredible work they do to assist those in need to engage in the process of recovery every day. Unfortunately, I cannot name all the dedicated people who have saved lives and restored the quality of life for many people in need. But I do want to take this opportunity to recognize their work and thank them all for that. Speaker, this Sunday we will celebrate Mother's Day. It is a time to honor the special woman who gave us life and nurtures us all throughout our lives. I think of the mothers who will not receive a card from their beloved son or daughters, and the only flowers they will see will be those lovingly placed at their child's graveside. Speaker, death due to the overdose or the suicide is the cruel legacy of addiction and the mental health crisis that go untreated. My heart goes up to the mothers who live with unspeakable grief and will be missing their child not only on Mother's Day, but every day for the rest of their life. Speaker, while that is the ultimate tragic consequences of the untreated addiction, overdose, and mental health crisis, there are many other heartbreaking losses endured by people who struggled with these issues and by the family and friends who loved them. Speaker, People with untreated addictions and mental health illness lose their dignity, self-worth, confidence, and sense of security. Their family and friends contend with feelings of anxiety, frustration, and hopelessness as they try desperately to convert their loved one to accept help. Sometimes, despite their best efforts, their loving guidance is refused. Speaker, the truth is, no one can save another person for recovery to succeed. The person affected by an addiction or the mental health crisis must accept help. Accepting help requires measures of personal responsibility. That is not always possible when a person is in trauma or the crisis situations. But if they receive the appropriate intervention in time to get them through the crisis, they will often be in better frame of mind to accept the help offered. Speaker, turning to substance use as a way of self-medicating medical health symptoms is only a temporary solution and can easily spiral into a state of dysfunction. Speaker, with help, the mask can be removed, and the pain one is dealing with can be worked on to find healthy coping strategies. There is hope and there is help. Speaker, while some people survive to share their stories, others do not, and this must change. Recovery Month will emphasize the hope of recovery with help. Speaker, at the second reading of this bill, I share with you a story about the life of the young man named David, whose life ended suddenly by suicide. He had been dealing with a number of mental health issues, trauma, and addiction. Like many people in similar situations, he tried to manage his pain by self-medicating with alcohol and substance use. David's parents are devastated by the loss of their only child, their beautiful son. Their shared dream for this future are now buried with him. But their dearest hope is that his story will inspire others to seek another solution before it is too late. So they will find the courage to embrace the hard journey of recovery. They want David's memory to spare other individuals and families from experiencing such a heartbreaking loss. Speaker, Recovery Month emphasizes the value of prevention and the hope of recovery with help. My heartfelt thanks to Honorable Minister Michael Toboro, Associate Minister of Mental Health and Addictions, for his incredible work, leadership, and support of this bill. Speaker, by proclaiming September as Recovery Month in Ontario, Bill 250 will awaken public awareness about mental health addictions, overdose, and suicides. It is up to us all to stay awake, alert, and aware. Thank you, Madam Speaker.
Thank you.